Good morning or afternoon, depending on when you're listening to this. My name is Michael Ayers, and I am the co-director of the Center of Excellence for Hypertrophic Cardiomyopathy here at the University of Virginia. And I'm very excited on HCM Awareness Day to give you guys some updates about what's going on down here in Charlottesville. Before we do any of that, though, as always, I'd like to take a pause to thank the HCMA for their tireless effort to help both patients and families of those affected with hypertrophic cardiomyopathy. So thank you, as always. With that said, brief outline, what we're going to do today is reintroduce you to some of the team. If you've seen previous recordings, some of that might be a review for you. We're going to go through some updates about what we're doing here at the Center of Excellence, and we're going to talk about what might be next, briefly. For those of you who have heard me speak before, I like to discuss the 4 pillars of hypertrophic cardiomyopathy management, whether it's the genetic piece and how that affects loved ones, whether it's heart failure, which is another term for shortness of breath, or arrhythmias, abnormal rhythms from the top or bottom chambers of the heart, or if it's lifestyle. Whichever of these 4 pillars we're discussing, though, we really think of imaging as the linchpin to management, which is why we feel so fortunate here at the Center of Excellence that the co-director, Chris Kramer, our founder of our Center of Excellence, has really made his career in imaging hypertrophic cardiomyopathy. The gentleman to his left there is yours truly, the other co-director here at the Center of Excellence. Moving to the top right, we'll talk about Matt Thomas. We're very lucky to have Matt here. He is a national expert in cardiovascular genetics and helps patients and their families understand their risk. On the bottom right, we are going to talk about some of the more players here at UVA. The gentlemen in the bottom right-hand corner are Mike Ragasta and John Kern, who help us when we think we need a mechanical solution, whether it's through a catheter in the leg or whether it's through an open heart surgery to help alleviate some of the obstruction of blood flow out of the heart. And the gentleman in the center there is our director of transplantation and advanced therapies for heart failure at the University of Virginia, because as we know, sometimes this condition progresses and you need some advanced therapies. So we're lucky to have that robust option here at UVA when needed. On the bottom left, we have Pam Mason and George McDaniel, who are our leads on the electrophysiology or heart rhythm specialist side of things. And on the top left, we have our other primary deliverer of care outside of Dr. Kramer and I, and that is Dr. LaCoyer. And between the 3 of us, we really focus on not just your hypertrophic cardiomyopathy, but how your hypertrophic cardiomyopathy relates to exercise and other comorbidities. And if you've been to our center, you know that we cannot continue without mentioning the nurses who take care of all of these patients and really are tireless in their efforts. My nurse, Karen McLean, and Peggy Dame, just 2 that I'll mention. So in terms of our center, updates that we're excited about. We received a large grant to start developing a database that's going to be a living registry that communicates with Epic, our electronic medical record, to in real time follow our patients so that we can quickly analyze retrospectively how we're doing in different metrics. We also received a grant to study the effect of mavacamten, a cardiac myosin inhibitor, a new drug for obstructive hypertrophic cardiomyopathy, to understand a little more how this drug and how this class of drugs is going to affect microvascular health in patients with HCM, the small blood vessels. We're actively enrolling, though, in multiple trials, both with cardiac myosin inhibitors, interventional therapies, and genetic therapies. And amidst all of that, we've really developed a robust experience writing mavacamten. In fact, BMS has reached out to our center now on multiple occasions to travel around the country to talk about how we're able to prescribe this medicine so well. And we have an abstract at ACC, the American College of Cardiology, describing our experience in helping get this medicine to patients who need it for an affordable cost. This team that's working on mavacamten for us really consists of not just pharmacists, not just physicians, but also nurses and our echo lab to coordinate all of this care. We have multiple publications that are ongoing. In addition to the abstract I mentioned at ACC, we have 3 or 4 other ACC abstracts that we'll be presenting soon. And we have a paper that I'm very excited about that should be coming out soon that looks at how diagnosis, prognosis, management, and family screening changes when you move your care from a low volume center to a center of excellence, in this instance, UVA. We're also one of the co-principal sites for HCMR, which is a study looking at how the tissue itself changes in different therapies in hypertrophic cardiomyopathy, and we should be adjudicating or assigning results and reporting that out soon. And then what's after that? Well, in some ways, your guess is as good as mine, but I'll give you some thoughts. I think we're going to really start to see studies that are sussing out how cardiac myosin inhibitors compare in the prognosis and long-term outcome of patients compared to traditional therapies or myectomies, procedures where we're removing a piece of the heart muscle. We're going to get more robust family screening programs when we utilize databases like the one we're developing. And we're really hopeful that we're going to get some drugs in the pipeline soon that are looking at interventions on a genetic level for patients with early onset of their hypertrophic cardiomyopathy. This is just a brief review of all of the cast of characters here at UVA, where we like to say we deliver expertise to individuals and those they love, and we're really hopeful you take the time to make your family part of the UVA family. With that, I will pause, and hopefully I'll make a live appearance at this point, but thank you so much for your time. How was that, Stacy?